This conference will now be recorded.
Welcome in, everybody. On today's lecture, we are going to be talking about EMS wellness and the well-being of the EMT. So this is a very important chapter because of some statistics that we're going to go through. So we're not only talking about physical wellness, we're also talking about emotional wellness. As this job, this career, even from a volunteer standpoint, this is a very physically and mentally demanding job. So first I want to pinpoint the statistic that the average EMT career length is only about 5 years. Now this number is going to be skewed as a lot of EMS professionals end up going and advancing their career or paralleling their career into a registered nurse, physician's assistant, what have you. But a lot of individuals end up going a different career route based on the fact that some of them can't handle the physical or mental stress that this job actually entails. Other frightening statistics is when we're looking at EMS personnel, and they kind of lump this into law enforcement and firefighters as well, is that 16 to 24% suffer from post-traumatic stress disorder from a significant call that they've been on, whether it's a mass casualty incident, a significant car accident, maybe the death of a child. And then we also have the average depression and anxiety rate is 6 to 7%. Now, that number might not seem substantial, but when you compare it to the national average, it's quite a bit higher, especially when you're comparing different career fields. Then on the bottom, we can see statistics too based on suicide attempts and suicide contemplation. 37% for EMS providers in comparison to 3.7 as far as that contemplation route. Now, this lecture is not based on a scare tactic. You should not feel that this is a red alert button that maybe you chose the wrong profession or wrong career, because there's plenty of individuals that I've worked with who've been in the field for 40 years, but they've taken the correct steps and procedures in order to better protect themselves. And as a result, they've had a very good career. They've saved a lot of lives. They've helped out the community. This is a very rewarding career. This is a great profession. It's just we got to keep in mind that we are going to be experiencing things that the general public either A, doesn't know about, or B, cannot contemplate. So again, we want to go through steps in order to protect ourselves physically and then also protect ourselves emotionally. And the question is why? Why why are these statistics so staggering? And one of the big reasons is the fact that a lot of us have a very difficult time disconnecting our career from our personal life. You know, I have two brothers. One's an entrepreneur. He runs a painting business. The other one's an English teacher. Those two individuals, they don't take their work home with them. However, for myself, it's very difficult for me to disconnect my professional life, my career life, with my personal life. And it's just one of those things because A, we're proud of what we do, and B, we literally encompass all of EMS or fire and law enforcement in our personal career. But there are steps that we need to take in order to disconnect ourselves from one area to the other. So we're going to look at stages of alarm stress, and we're also going to look at eustress versus distress. So the stages of alarm, first we have the alarm stage. The body responds to this as if in a fight or flight response. So what our body is going to do is it's going to drop all the adrenaline, all the epinephrine, all the norepinephrine into our system. And as a result, we are going to start thinking with our animal brain in comparison to our frontal lobe, which is where our personality comes from, our decision-making processes. So we can kind of compare this into lengths of a career too. So for those of you who have not been on a 911 call in your career yet, you're probably going to experience this alarm stage the first time that those tones go off. Those tones are going to go off. All that blood is going to be shunted to your core. You're going to feel goofy, maybe a little bit dizzy, and your heart is going to be flying. Your blood pressure is going to be elevated. Now, the next stage is going to be the resistance stage. So at this point, that individual is able to deal with those stressors and that body returns to normal. So maybe, again, taking that example of your first call, you get into the truck, your partner is able to reassure you, you get on scene, and then you kind of get into the mode of your training and your education. Or oftentimes we'll see this with veterans within EMS or fire or law enforcement where those tones go out, but it doesn't trip them into that fight or flight response because they're used to it. They built up a defense mechanism and they know how to handle that stress a little bit better. The last is going to be the exhaustion stage, and your body is not adapting at all to any stressors. It's basically like the color gray at this point. Your body's not reacting, your frontal lobe of your brain isn't reacting, your animal brain isn't reacting. And when we're looking at this is kind of like the burnout phase of an EMS career. So maybe somebody's put in 20, 30 years, and as far as their compassion for their job, their empathy and their sympathy begins to deteriorate. And when those tones go out, it's automatic negative feelings towards the job, towards the patient, towards the career. And so this is what we really want to combat because, again, like I mentioned earlier, there's a lot of individuals who've been doing this job for years and years and years and still find great pleasure in doing this career. Now, along with the stages of alarm stress, we got to be looking at what eustress is and distress is. So eustress is a positive, stressful experience. So, for example, getting married, that is going to be a stressful day on the bride or the groom, but that's a positive stress. That's eustress. Distress is going to be the negative consequence of that stress. So, losing a loved one, something along those lines, that's going to be distress. That's negative stress that's negatively affecting the body. So, our response to these stressors, there's the acute stress response, delayed stress response, and cumulative stress response. So first, let's take a look at the acute stress response. So acute means short acting. So these are stress reactions most commonly linked to sudden or unexpected events. So this can be our mass casualty incidences, large earthquakes, basically our definition of a disaster. So the signs and symptoms that somebody might possess are going to be immediate or during that event. So that, again, it's going to be that immediate response to that specific stressor. Delayed stress response. So again, most often this is going to be correlated to a single event. However, in comparison to the acute stress response where we displayed those signs and symptoms of the distress immediately, the delayed stress response is going to occur maybe days, maybe months, maybe even years later to that singular event. Now, the most common stress response that we're going to see in EMS providers, especially if they've done this job for a continuous amount of time, is going to be the cumulative stress response. Now, where it differs between the delayed and the acute is this is a multitude of stressful events that have happened, calls built on calls, and eventually, based on all of that stress that that individual's entailed, then they start to experience signs and symptoms from that stress response. So, how we prevent this? As mentioned earlier, we need a good balance between our personal life and our professional life. Exercise, and this does a lot of things for us. It releases epinephrine, norepinephrine into the system, and then it also releases dopamine, and then other feel-good chemicals inside the body. Another thing that exercise does for us is keeps us physically in shape too, because a lot of EMS careers are actually ended by back injuries. Again, we want to keep in shape because of all the physical stress that we put on our body from lifting EMS bags, cardiac monitors, AEDs, and then of course our patients as well. A lot more research and data is coming out as far as proper nutrition and how that can actually prevent stress. Again, this is going to correlate into our physical well-being as well. And then lastly is going to be our critical incident stress management. So these individuals will actually go and talk to different EMS groups, different fire departments, law enforcements after a critical incident. And this way you can actually decompress a little bit. You can talk about your feelings. Now, for years and years, the tradition of fire departments and EMS departments basically is you're showing signs of weakness when you do talk about your feelings. Don't have this mindset, because this is where it bottles up, and this is where it can actually lead into that burnout phase. So again, these individuals are trained for specific fire departments, EMS departments, law enforcement departments, that they can actually go in there and provide that rehabilitation process for these individuals. Other things as far as protecting ourselves, remember our physical barriers. We're going to talk about this quite a bit when we get into patient assessments as far as taking proper BSI. So always keep that in mind. What barrier devices, what BSI do you need on that call based on the dispatch information? And then also what your general impression is of that patient when you do arrive on scene and start performing that patient assessment, because maybe you need additional gear. Now, on every call, we're always going to glove up, but maybe we need a gown, maybe we need an N95 mask or safety glasses. Again, always be over prepared in order to prevent yourself. There's a lot of statistics as far as disease transmission for healthcare workers, specifically hepatitis B, HIV, hepatitis C, and hepatitis A. So again, we want to prevent that. So using your gloves, using those barrier devices, if you can get immunizations. Now, the only immunization out there right now is for hepatitis B, but they are making progress in some other categories. Where people really run into issues as far as the disease transmission is with sharps exposures. So be mindful of where your sharps are located on that scene. Make sure that they're getting into the sharps containers in order to protect the integrity of that scene and then everybody on that scene. So that wraps up for the well-being of the EMT. What I highly recommend everybody to do is to rent the movie Bringing Out the Dead with Nicolas Cage. It depicts an individual who's going through post-traumatic stress disorder. He's a paramedic with New York City Fire Department. So this really paints a good tale of somebody dealing with those stressors basically the wrong way in order to deal with it. All right, that wraps it up. Thanks, everybody.